Hi everyone, thank you so much for joining us for this virtual presentation. Today's topic is about anxiety during cancer treatment. If you like this video, make sure to give us a like and or leave us a comment down below. Now, without further ado, I'd like to present to you health psychologist, Dr. Veronica Regueiro.
Hi everyone, I'm Dr. Veronica Regueiro. I'm a licensed clinical psychologist in the state of California, and I'm here today to talk a little bit about anxiety during the course of cancer treatment. Along with being a licensed clinical psychologist, I'm actually credentialed as a health psychologist, which basically means that my area of subspecialty or one of my areas of expertise is the relationship between physical health and psychological health, and how different things like cancer diagnoses and other diagnoses can sometimes impact us in terms of our mood and our overall functioning. So, today we're going to talk about the prevalence of anxiety when it comes to folks who are diagnosed with cancer. And we're also going to talk about some things that can help if you yourself are experiencing anxiety while undergoing cancer treatment or even after you've completed treatment. Now, some of this presentation is based on my own personal experience working as a clinical psychologist in a healthcare setting, but it's also important to know that the things that we talk about are based on scientific evidence, they're based on research. And at the end of this presentation, you'll see a couple of slides referring to the scientific articles, to the journals that were used to put together some of this information. It's really important to note that if you are experiencing any kind of anxiety or any kind of distress because of a cancer diagnosis or because you're going through treatment, the best thing to do is to reach out to your treatment team, talk to your physician, talk to the social worker on your team, see if you can get a referral to a mental health provider. Today's presentation is going to be educational, which means that we're going to be talking about some different things and providing resources, but it is by no means a substitute for a licensed and trained mental health professional. At the end of the presentation, we will talk a little bit about how to find a therapist if you yourself are struggling. So first, let's talk about what is anxiety. For a lot of us, the word anxiety can mean different things. And some of the things that we think about when we hear the word anxiety actually fit into what a mental health professional would consider to be anxiety. But there are also things that happen in our minds and in our bodies that can tell us that we're feeling anxious, even if we don't maybe recognize those as anxiety symptoms right off the bat. So for most of us, we know that when we feel nervous, when we feel restless, when we're feeling tense, maybe we're experiencing anxiety. When we feel like maybe something really bad is coming to us, like we have this overwhelming sense of doom, that could be anxiety. What a lot of people don't realize is that being really cranky can also be a sign of anxiety, and that different things such as difficulty concentrating, having a really hard time controlling your thoughts, having a really hard time controlling worry, those can also be symptoms of anxiety. Anxiety doesn't just impact how we feel, it can also impact our cognitive functions and it can impact how we feel in our bodies. So, all of these things that we feel can be indicators that we are experiencing anxiety. Our behaviors can also show us that we're experiencing anxiety. So if we find ourselves avoiding different things, different triggers, the fact that we're avoiding those things could be a red flag to us. I wonder if this situation, I wonder if this thing is maybe making me feel anxious or making me feel nervous to some extent. Our bodies respond to anxiety as well by having our hearts suddenly start to beat faster. We might find ourselves breathing much more quickly than we usually would. We might find ourselves breaking out into a sweat, maybe getting a little bit shaky. Fatigue can also be a symptom of anxiety. So when we feel ourselves finding really, really tired or just really fatigued, kind of lethargic, that can indicate to us that we're experiencing some anxiety. Sleep issues are also very common when folks develop anxiety. And it's also very common to develop GI issues, so stomach problems, and also muscle tension. All of these feelings, all of these things that impact our cognitive functioning, all of these things that we feel in our body, they're all symptoms of anxiety, some of which we generally think about when we think of anxiety, but some of which we don't think about, such as just feeling really tired or fatigued all the time, or being kind of cranky, kind of lashing out at people that we love. All of this is a red flag that someone might be experiencing anxiety. Now, there are lots of situations in life where it's very normal to feel anxiety. Anxiety doesn't have to be this big, scary thing of, oh my goodness, I'm having all these feelings or my body feels this certain way. Anxiety is there to tell us when there's something scary or overwhelming that's happening. So, for example, for most people, sitting down and taking a test can be very anxiety provoking, or having a performance evaluation at work. Having a child miss curfew. If you're a parent and you told your child to be home by 10 p.m. and it's 11 and they're not there yet, it's very normal to feel worried about, where is my kid? What's going on? Did something happen? Public speaking can also be very anxiety provoking for a lot of people, but also things like receiving difficult news about yourself or someone that you love, having any kind of medical diagnosis that's new, or undergoing any sort of complicated medical treatment. These are all things that, for the vast majority of people, are going to cause some sort of an anxiety response, such as feeling nervous, feeling restless, getting really cranky, having trouble concentrating, feeling your heartbeat faster, kind of breaking out into a sweat. All of those anxiety responses are very normal when we're in scary situations, including having a medical diagnosis or undergoing treatment or even finishing treatment and then wondering, is my cancer going to come back? What happens next? Anyone who's received a cancer diagnosis can tell you, it's no secret. Patients who receive cancer diagnosis and have to undergo treatment are at very high risk of developing anxiety. There are so many points along the journey that are just scary, that are overwhelming, from receiving the diagnosis to being given all of the information about treatment, to thinking about the financial aspects of treatment, to thinking about how to manage your family, to think about, okay, maybe you're now in remission, but what do you do if the cancer comes back? Even things like being in recovery and being anxious about how to get your life back to normal. For the vast majority of individuals who receive a cancer diagnosis, all of these points in time can be really scary, really overwhelming, and very anxiety provoking. And that's very normal. Most people with a cancer diagnosis will tell you that they experienced some form of anxiety at some point in their journey. So if you find yourself feeling anxious, either because of a new diagnosis, or because you're being given treatment information, or because you're approaching the end of treatment, you're not alone. You're part of a large community who's experienced a very similar journey in terms of how they've felt regarding diagnosis and treatment. Now, incidentally, women who receive cancer diagnoses are more likely to develop symptoms than men. And this anxiety can contribute to feeling really overwhelmed, to having conflict with spouses, with children, with friends. Anxiety can also really impact how we're able to follow treatment regimens. Remember that part of anxiety is being really fatigued, having a hard time concentrating, avoiding things that make you anxious, also having physiological symptoms like GI issues. Some of those physiological responses just happen anyways during the course of cancer treatment. But when anxiety enters the picture, it can make those symptoms worse. This is what we think about when we think about things that exacerbate physiological symptoms. Anxiety can make the side effects of chemo or the side effects of cancer feel a lot worse, and then cause us to do things like sleeping too much so that we maybe miss appointments, or having a really hard time following a treatment regimen, or trying to avoid the things that are scary to us, like maybe not wanting to talk to our oncologist or to the nurse practitioner that's there to offer support. Because anxiety and any kind of psychological distress can really impact how a patient approaches cancer treatment and just how someone feels during the course of their day, it's really important to find a way to manage symptoms of anxiety in a manner that's proactive before the symptoms get out of control. And that's something that we're going to talk about a little bit today to offer some resources in the event that you yourself are feeling anxious. An evidence-based tool for managing anxiety is called mindfulness-based stress reduction. There's a ton of research in the scientific community about the positive effect of mindfulness-based stress reduction activities when it comes to managing things like anxiety. There are actual studies that have been done specifically with cancer patients to show that mindfulness is really effective when it comes to reducing anxiety and kind of managing the symptoms that come along with anxiety. Now, for those of you who don't know what mindfulness is, it's most easily described as a kind of meditation, but it's not a kind of meditation where you're kind of emptying yourself and just letting your mind be blank and not have any thoughts. It's more about being in contact with the present moment to the exclusion of everything else, and not making up interpretations or stories or judgments about however you might be feeling or whatever you might be experiencing. So, for example, if you're having a moment where you're feeling really nervous, really anxious, really scared, oftentimes it's just part of what humans do to have those feelings and then tell themselves things like, oh, I shouldn't be feeling anxious, or I shouldn't be feeling scared, or I have no reason to feel this nervous. There must be something wrong with me. Why do I feel this way? And sometimes having that internal dialogue can actually make symptoms of anxiety worse because we're being so hard on ourselves, because we're judging ourselves. And then we kind of get ourselves worked up, not just about how we're feeling, like nervous or anxious or scared, but also the fact that we're even having that emotional experience. In mindfulness, we just pause and we notice, oh, I'm feeling really anxious right now. I'm feeling really scared. And we don't engage in that internal monologue of judgment and blame and wondering what's wrong with me. Why am I feeling this way? Mindfulness is very often used as kind of a band-aid approach. The idea being that, oh, this person is feeling really anxious, or this patient is feeling really scared. Let's have them do this deep breathing technique. Let's have them do this mindfulness-based exercise, and they'll feel better. When people give recommendations like that, absolutely, in a moment of high stress, any form of mindfulness exercise might help you feel better. But the best way to implement mindfulness is to actually do it a little bit every day, practice it a little bit every day, so that when you are in distress, when you are feeling really overwhelmed, you're able to utilize it as a skill, as a tool that you've practiced to help yourself stay calm, or at least stay a little bit more regulated than you maybe would have otherwise been. Now, you might be asking yourself, well, what does this look like? Okay, mindfulness is a form of meditation. How do I do this in my day-to-day life? And there's lots of different ways that this can look. Mindfulness can be as easy as just sitting, taking some slow, deep breaths, focusing only on your breathing, maybe just taking 3 breaths if you don't have a lot of time. If you have a little bit more time, just sitting quietly for a couple of minutes and breathing slowly and breathing deeply for 5 or 10 minutes. Mindfulness can also look like listening to a recording of a guided meditation, of a guided imagery. In that kind of mindfulness-based exercise, you're basically closing your eyes and you're listening to someone tell you a story in which you're the participant. For example, pretend that you're on the beach and this is what you're seeing and this is what you're hearing and this is what you're smelling. or pretend that you're on a mountain. And again, what are the sensory experiences associated with that? Progressive muscle relaxation, also known as PMR, is another way of engaging in mindfulness. This is where you systematically contract and then release the muscles throughout your body. And then just mindful living, which might look like going and taking a walk. And instead of having lots of thoughts running through your mind about what's making you nervous, what's making you anxious, just focusing on what you're seeing, what you're smelling, what you're hearing when you're on your walk, whether it's the leaves changing colors or the feeling of the bright, warm sun on your skin or the scent of fresh cut grass. Just being attuned to those sensory experiences instead of getting really caught up in your thoughts is a really great way to practice mindfulness. Now, as I mentioned, mindfulness is most effective when you do it a little bit on a regular basis. So, the research actually shows that practicing for 20 minutes a day for a total of 8 weeks can really change the structure of your brain so that it resets your baseline in terms of what can maybe escalate you, what can make you feel really overwhelmed. When you're someone who's going through cancer treatment, it can very much feel like you don't have 20 minutes a day to engage in mindfulness meditation, especially if you are also trying to manage your home, manage your kids, still work. It really depends on where you are in terms of your journey and in terms of your schedule. So, what I tell folks is try to start with setting apart a little bit of time each day. If all you can do is just 2 to 3 minutes, start with 2 to 3 minutes. If you can start with 5 to 10 minutes, start with 5 to 10 minutes. But just start working a little bit at a time to build up your practice because even a little bit each day can help you feel more calm, more grounded, more centered in the moment. So, right now, we're going to try just a very quick exercise to kind of give you a feel of what mindfulness can do for you. So, if you are in a place where you're listening to this recording and it's quiet and you're not driving and this will not be too distracting for you, then go ahead and just close your eyes and try to tune out whatever's going on around you and just listen to the sound of my voice guiding you through this exercise. All you're going to do is take in a deep breath. You're going to breathe in and out. And you're going to breathe in and out. And in and out. If it helps you get into contact with just the feeling of the air going in and out of your body, you can go ahead and put one hand on your chest or one hand on your abdomen and focus on the feeling of the hand going up and down as you breathe in and out. But the goal of this is to really just focus on the feeling of the air as it goes in through your nose and then back out through your mouth again. Only focus on that sensation to the exclusion of whatever else is going on around you, to the exclusion of whatever thoughts you might be having. It's very normal when doing any sort of mindfulness based exercise to find yourself distracted by things going on around you and maybe thoughts that come up, even thoughts about the exercise that you're doing. And if that happens, that's totally, totally okay. Just notice that that thought is there or that you maybe heard that sound and just refocus your attention. And that's what mindfulness is just constantly refocusing your attention, constantly bringing it back to whatever it is you want to be focused on in that moment. In this example, the feeling of the air going in and out of your body, but maybe in a different exercise, the example would be a little bit different. there are some great resources for those of you who might be interested in learning a little bit more about mindfulness. Now, as I mentioned, doing this kind of adaptive coping skill, practicing mindfulness on a regular basis is really helpful and can absolutely improve the overall feeling that you have of well-being on a day-to-day basis. But if you find yourself really struggling, reach out to your treatment team, because just hearing this kind of information in an educational seminar or webinar format is definitely not a substitute for talking to your physician, talking to a mental health professional, maybe talking to the social worker on your treatment team to see what resources are available. Absolutely reach out for support if you find that you're really anxious or really struggling. Your treatment team is the best source to connect you with different resources, with different referrals. If you are interested in just learning about mindfulness, however, there are some really well-regarded institutions that have information that's available to the general public. So Mayo Clinic has a great website where they just talk about what mindfulness is, and they give an example of a couple of different exercises that you can do at home. UCLA has an institution under the UCLA umbrella, which is called the Mindful Awareness Research Center. And at the Mindful Awareness Research Center, they have a website that also talks about what mindfulness is. They have a great video that provides general information. It's about 20 minutes long. And they have free exercises that you can either download to your computer or you can just listen to straight from the website, so you can kind of get a feel of what an activity, a mindfulness-based activity, might look like if you practice it at home. Incidentally, the UCLA Mindful Awareness Center also has an app that you can download to your phone, so you can listen to some of those exercises just straight from your phone. There are also a couple of apps that are really helpful that you can download. Both of these apps have a free version and also a paid version. Both of these apps use mindfulness-based activities to promote relaxation, stress reduction, and to help manage anxiety. The first app is called Calm. The second app is called Headspace. If you watch television, you've probably seen commercials for these two apps because lately they've been playing a lot of advertisements. So these names may be familiar to you. If you download them to your phone, you'll find that they have different guided imagery exercises. They have different breathing techniques that you can listen to, and they just have a whole variety of meditations that could help you in managing anxiety. Now, if you start practicing these mindfulness-based adaptive coping skills, the mindfulness-based stress reduction, and it's helpful to you and you want to learn more about it, finding a mental health specialist who is able to provide you with more one-on-one intervention in this area would be a really great idea and would be really helpful. And as has been mentioned, if you're really struggling, finding a mental health professional is really a great first step to take care of your mind while you're going through cancer treatment. The Pink Ribbon Place has counseling services which are available. You can also find a mental health professional through your insurance company. The American Psychological Association, Psychology Today, and the National Register of Health Service Psychologists are also great resources for anyone looking for a mental health specialist who can help them manage symptoms of anxiety that they might be experiencing while undergoing cancer treatment. Now, if you've never done therapy before, you might ask yourself, how do I even know how to pick the right treatment provider? Which is a really great question. You will see, for example, if you go to the Psychology Today website, that there are a lot of different mental health providers who operate in either private practices or different clinics. There are LCSWs, which are licensed clinical social workers, and there are LMFTs, which are licensed marriage and family therapists. Those are both master's level clinicians. And then you have what's called a PsyD and your PhD, and generally speaking, those are licensed clinical psychologists. Anyone who is licensed in the state of California will have a license number that they can provide you with, Whether they're an LCSW or an LMFT or a licensed clinical psychologist, they should have a license because their field should be regulated by the state of California. When you're trying to figure out what kind of mental health professional to go to in order to help get symptoms of anxiety a little bit under control, you always want to think about their competence and the training that they've had. So making sure that they are able to provide the intervention that you're looking for, maybe mindfulness-based stress reduction in the example that we're going to use today. But you also want to make sure that you're going to a mental health provider who knows how to work with clients who have medical diagnoses. If you're going through cancer treatment, you want to make sure that whoever you work with is familiar with the side effects of different treatment regimens and with all of the complicated nuances that come along with cancer treatment. Most importantly, you want to make sure that you have a good relationship with your treatment provider, that you feel like you can trust them, that you feel like you click with them, that you feel like they're going to be able to support you on your journey. So, as was mentioned in the beginning of the presentation, we have a couple of slides here with references so that if you are interested in finding some additional information regarding anxiety during cancer treatment or what might be helpful, you can either look up these articles, you can ask your physician or the social worker on your treatment team if they have any resources that they're able to share. The most important thing to remember is that there are resources out there. If you're experiencing anxiety during the course of treatment, you're not alone. It's very common to be anxious, overwhelmed, afraid at multiple points of treatment, but there's also hope. You don't need to go through those feelings alone. You don't need to be isolated while you experience those emotions. There are lots of resources, things that you can do at home, and things that your treatment team and mental health specialists can offer you if you feel like you need that support. The Pink Ribbon Place is here to support you, so you're always welcome to reach out to them with questions about any of these resources. And for my part, I very much appreciate the opportunity to speak with you all today to share these resources.
Thank you, Veronica, and thank you to all for tuning in today. Don't forget to follow us on our social media pages at The Pink Ribbon Place for program updates and for information on future presentations.